Like everyone else, here in Davis, California, we watched COVID-19 devastate communities.
Davis is a small college town, so to create the safest environment possible for everyone here in Davis,
We knew we had to draw on all the strengths in our community.
The city and the university teamed up to do what no other place did during the pandemic.
Health behavior change is very complex, and we try to do things that are going to instill effective messages, actually try to incentivize people to do the right thing.
Everybody loves the mask. That's usually a good thing, and also a really positive incentive to encourage people to wear masks is a free mask.
They have hand sanitizers, of course. These are unique because they have a QR code on them. You scan this with your phone, it takes you right to the HPT website and shows all the COVID testing sites and how to book an appointment.
You have to be able to instill appropriate behaviors to control a pandemic or an epidemic. So the idea of the project was to combine epidemiology with health behavior change. If you're going to try to control an epidemic, you're going to do that involving the community because the students are part of the community when they come back. The other thing that we did was we knew that peer-to-peer education was really important. So health education happens not just by reading printed volumes or seeing videos on television or social media, but it actually happens at the person-to-person level.
even participation from our students, our ambassadors, Aggie public health ambassadors, reminded people to wear their masks and went out into the community and educated people and answered questions and sit at the front doors of buildings like this one and make sure everyone's done their daily symptom survey.
The ambassador program was set up with three main objectives. They were to educate, they were to building a community, and they were to encourage people because we knew it was going to be a long haul. So how do you keep people encouraged to wear their masks and to continue to do the physical distancing and hand washing?
Sometimes in our downtown shifts, we like to split up. Some of us head over to actual downtown. Some of us stay at the farmer's market. In downtown, sometimes we go to the Arboretum, and so it's always nice to have these out to give out to community members.
You start with epidemiologic infectious disease control. That's really an important part of trying to get your handle on an epidemic or a pandemic. But the other side of it was looking at health behavior.
We don't enforce, we educate. We build community. How do you make people feel included? How do we break the isolation of having a mask, having to acquire the physical distancing, but also encourage people that we're part of the same community and that you're valued. And because you're valued, we want to keep you safe.
We're celebrating graduation, woo! We're lucky enough and fortunate enough that we're able to have some sort of commencement, and my job is to make sure that everyone's all right and healthy and good to go, so we're just checking vaccination records or proof of a negative COVID test. Thank you. This is your guys' ticket, and wear that. Remember to wear your mask, stay 6 feet from other people, and have fun. You're welcome.
When Healthy Davis started meeting with all these groups, county, city, campus, and school district, our local school district, the messages were extremely simple, very graphic. Wear a mask, get tested, wash your hands, maintain your distance. And they were able to execute that on buses, on billboards, on cable television. Easy, available saliva testing was beyond amazing. That was at a moment where everybody was so nervous about whether they had the virus, will their children have it, will their grandparents have it? And we had the opportunity to say, guess what? You can come, you can get tested regularly for free, and it's easy. We started to understand that there are populations, there are people in our community who maybe aren't getting our message, even though we're using newsletters and we're using flyers and print and broadcast. Our pastor at the community church, 2 of our priests from the Catholic Church here, St. James, the rabbi, and some representatives from our Islamic community. We filmed these faith leaders saying in their own words to their communities why they felt it was important to follow the guidance.
But for those of us who are trading those freedoms for the joy of being here are a few things that we'd like to ask you to do to ensure everyone's safe. Wear your mask over your mouth and your nose, please, the whole time you're here. Maintain social distance of 6 feet.
We have been a community, in essence, in exile for 15 months. Last week we came together, and it had been 64 Sundays since we had been together. Probably in the life of this congregation in 150 years, since 1869, I doubt the congregation had ever been apart from this place for more than a Sunday. But today, to have the choir outside the windows singing was so powerful. We couldn't sing inside, but we could hum, we could dance, we could clap. And the sheer energy of what it means to be together as human beings was there.
It is the first day of school back in person. It's really awesome.
We've been working at the Memorial Union with Welcome Week, where first years and transfer students and just general students coming back to campus seeing it for the first time. They have questions about COVID guidelines on campus. I've even had friends all say, I'm getting a COVID test right now if you want to come with me. And we go as a group and get COVID tested together.
Here in Davis, we were able to continue the messaging that getting tested is important. We had the chancellor amplify that message to the community. And so we've had, even though we did have a fall off in the volume of testing originally planned, we managed to keep testing going here, and testing has increased pretty dramatically since the Delta variant got on the loose. We're able to execute a lot of these interventions in the whole community there. What we've done is instilled a sense of community pride, trying to promote good health behaviors that will be lasting long after the pandemic is over.